the most diagnosed cancer in women in the U.S., but thanks to increased awareness and earlier detection, survival rates have increased as well. So this morning, Dr. Christopher Formen is back with us to answer the 10 most frequently asked questions about breast cancer screenings. Thanks for joining us again.
Hi, it's great to see you, Kim. Sorry we can't be in the studio.
I know. I cannot wait till you're back in the studio. We miss you. All right, let's get right to it because I know we have a bunch to get through. Question number one, is it safe to get a breast cancer screening during COVID-19?
Absolutely. You know, right now the hospital is one of the safest places to be because we wear our masks, we practice social distancing, and it's very important for patients to realize that we've seen an uptick in major illnesses and things such as cancer. So I would implore you, please, 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 come to the hospital and get the care that you need because we are about as safe a place on the face of the earth that you can find. So come to the hospital and get your mammograms and get your regular health care as well.
Question number two, why does someone need a mammogram?
Mammograms save lives. That's the bottom line. If you detect breast cancer at stage 1 in the very early stages, there is a near 100% success rate as far as survival. So think about that, 100% success rate getting your screening mammograms. It's imperative that everyone get their screenings.
At what age should we start having mammograms?
So the ACR, American College of Radiology, recommends that we start getting mammograms at the age of 40. There are caveats to that. If you have a very strong family history, if you've had radiation or other types of cancer, oftentimes we recommend that you do it about 10 years prior to that, so at the age of 30. So those are kind of our recommendations depending on your different circumstances.
Does an abnormal mammogram mean breast cancer?
Absolutely not. And this is an important thing to realize. That's a great question. So an abnormal mammogram simply means that there are changes in the breast or areas that we're concerned about. Does not mean you have cancer. So what we'll do is we'll see those areas, oftentimes comparing them to previous mammograms, and if there's a change, we will further investigate just to make sure we're not missing a cancer. But most of the time, those end up being benign findings.
Question number 5, can women with breast implants have a mammogram?
Absolutely. It's all come, all get served. So you just tell the technologist at the time that you have breast implants, and we will use our mammogram machines to get the appropriate views to make sure that we're not missing any breast tissue and thereby detecting everything we can possibly detect.
What does a radiologist look for when reviewing a screening?
You know, Kim, I look for a couple different things. Typically, we look for little white dots. We call those calcifications. Again, we look for changes in breast tissue. We have fancy terms for that, architectural distortion or asymmetric densities, but those are just subtle changes in the breast that can hide cancers oftentimes. So those are the main things that we look for.
There are so many different types of mammograms, 2D, 3D, automated breast ultrasound, MRI screenings. How do we know which breast cancer screening is right for us?
So for most women, it's going to be the 2D and 3D mammograms, which this machine uses. For other women, particularly those that have that positive family history that we talked about, or they have really dense breast tissue, oftentimes we'll use MRI for screening. We can use automated breast ultrasound, ABUS, for screening as well in dense breast, or we can just use handheld ultrasound for screening purposes. So we have different areas of attack to make sure that you're not missing any types of cancer.
We only have a couple seconds left. What does a traditional mammogram involve?
So a traditional mammogram involves this machine. So the patient will be placed in this machine and we'll do compression from top to bottom and from side to side. And then the images will be sent to a computer. That computer sends the images to the radiologist no matter where they are. They can be anywhere, literally. And then they can read those images and give you an interpretation and a diagnosis.
Dr. Formen, thank you so much for joining us. To learn more about breast screening services, you can visit nkch.org. Thank you so much.
Thanks for having us, Kim.
Have a great day.
You too.